That's a lot. It's a lot. Well, some 7.5 million Americans suffer from psoriasis, and for some, it's treated with a topical prescription. But for one little Tampa girl, the condition became so bad she couldn't stand to step outside. Well, this morning, find out about the controversial treatment that's turned her life around.
I had it all in my eyebrows everywhere.
9-year-old Brianna Mollenkamp is describing what it was like before being aggressively treated for severe psoriasis. The chronic inflammatory condition that affects millions of Americans had spread over Brianna's entire body, even her face and scalp.
It was horrible. Before we went to see Dr. Forman, Brianna, dead heat of summer, would wear long sleeve shirts, long sleeve pants, would not put on a bathing suit. She came home crying from school. The kids were teasing her, called her a chicken pox girl.
Frustrated with treatments and topicals that didn't improve her daughter's condition, Brianna's mom, Kimberly, went in search of a dermatologist willing to oversee more aggressive alternatives.
Not treating a disease like psoriasis, at least a severe case, risk of depression, the risk of heart disease, the risk of obesity in patients that have chronic psoriasis is overwhelming. Not treating this condition aggressively is a risk all by itself.
Dr. Forman felt he had no choice but to turn to a drug known as a TNF-alpha inhibitor, which inhibits parts of the inflammatory response, which causes psoriasis. The problem is the drug comes with a recent warning from the FDA that it might put children at a higher risk of developing leukemia lymphoma.
The problem is that chronic inflammatory diseases such as psoriasis, such as rheumatoid arthritis, such as the arthritic component of psoriasis, which is psoriatic arthritis, that can actually increase your risk alone of developing lymphoma and leukemia. So the data really isn't clear as to whether these drugs are actually increasing your risk of lymphoma and leukemia, or if this is just a natural part of the disease state.
Dr. Forman believes the benefits far outweigh the risks, especially if a dermatologist stays in constant contact with patients.
With this drug, it does tend to slightly lower the immune system, so if they tend to get a fever or a cold, you stop the medication until they get over this period. We have constant phone contact with Dr. Forman, the nurses. They're aware when my child sneezes.
But overall, Brianna is the picture of health, now able to enjoy things the rest of us might take for granted.
Now I can I can go swimming without anybody seeing my psoriasis.
And the doctor did provide me with pictures, and it was so sad to look at because they were all over her face, body, scalp, everywhere. And the kids used to make fun of her and call her Itchy Scratchy and all these horrible names. So
look at her
she's
skin.
all better now. Yeah, absolutely beautiful.
Wow, she looks beautiful.
We're going to have some traffic and weather updates coming your way.